Good afternoon, I'm Brian Wilk. We interrupt our programming to bring you a special report. Erie County officials are updating the community on the COVID-19 situation in the region. Today's virtual news conference is coming live from the studios of WQLN TV.
We don't have all of the details as this report did not come in until late last night, but county health officials are doing what we call contract tracing, and that is currently progressing. So they are finding out who this individual may have had contact with and then contacting those individuals. The state numbers are now at 480, and that is a number that has at least risen by more than 100 since yesterday. So obviously, our numbers continue to rise here in Erie County as they are across the Commonwealth. I want to thank again the people of Erie County who I have observed using great social distancing tools. I had to stop at the grocery store yesterday and people were definitely being conscious to stay 6 feet from others, and I want to just thank everyone for the work they're doing. I also ran into some neighbors when I took a walk. The dad had come to visit the young couple, and he was outside down on the driveway while the young couple was up on their porch, all staying well within 6 feet from each other, but still having the chance to visit with each other. And that's what I'm continuing to ask all of us to do. We hope in Erie County that we're ahead of the curve here, and we're trying to, again, flatten that curve in terms of how many people contract this virus. So the more that you can stay home, the more that you can stay socially distanced from other people, the better for all of us. I'd also like to talk a little bit further about the enforcement of business closures that's going to start taking place at 8 a.m. tomorrow morning. As we all know, the governor has said that businesses that are not essential for survival, basically, not life-sustaining businesses, will need to close. They needed to close actually as of last Thursday, but enforcement will start tomorrow morning at 8 a.m. We know that numerous businesses have submitted waivers to the state government to see if they can stay open. Late last night, I was on the phone with the governor's staff. They have thousands of these waivers to process through. Those waivers were being processed all night long. They had brought staff in, so they were going around the clock to try to get all of these waivers prior to tomorrow morning's 8 a.m. enforcement deadline. So we are waiting for the list of the waivers here in Erie County. The other thing that we are doing is we have had many, many questions from businesses, both businesses that aren't sure if they're going to need to shut down, and businesses that know they can stay open but are calling the county health department to find out how they can best continue to help their employees stay safe, as well as those who may be coming in to their business because of their life-sustaining needs that they take care of. The number for a business who has a question is 451-6700. But we also have much information on the county's website, which is eriecountypa.gov. Again, eriecountypa.gov. Pretty much all of the material that we have developed and all the policies and procedures is listed out on our website, and so we really encourage you to check out our website, and if you still have questions, you can call 451-6700. So we will continue to monitor the situations with the business closures. Again, our environmental task force team is there to answer questions and to really help our businesses abide by the enforcement set out by our governor. And with that, I'm going to find out which media outlets are on the phone here and ask for questions. First of all, do we have with us Erie News Now?
Hi, yes, this is Rachel of Erie News Now.
Would you like to ask a question?
Yeah, can you talk a little bit more about this new case? Do we know if the person traveled outside the county and that's how they got it, or was it a case of community spread?
So we are still gathering data on that to try to figure out if it is a if it seems to be travel related, or do we believe it's community spread. So again, this came in late last night, and so information is still being gathered on the potential travel or not of that individual. How about WJET,
You
I'll
know,
come back for second questions to each entity. WJET TV, are you on with us?
Yeah, hi, Kathy. Samir from Jet. So someone's programming actually interrupted you while you were speaking. So I got the person is in their 20s, and that's about it before their show actually interrupted the press conference. So could you backtrack a little bit? Also, did this person, were they tested at a hospital, at the St. Vincent site, primary care?
So, Samir, the individual who is now our third positive case here in Erie County is in their 20s. They're a resident of Erie County. I actually don't know the location of where they were tested, and we are still gathering information on that individual, from that individual, trying to get the full list of contacts that they may have had so that we can respond appropriately. Do we have with us the Erie Times News?
Yes, County Executive Ed Palatella from the Times. Can you hear me?
I can hear you, Ed.
So, this person, are they quarantined in a hospital? Can you say at this point about that?
I can tell you they're not in a hospital. They are quarantined at home, and they're very aware of the necessity for that, and you know, obviously cooperating with us, and we're grateful for that.
So this person's health is fairly good right now?
Yes, they have the symptoms, but, you know, they're a 20-year-old and 20-something, and they are in good health. It's very interesting that our three cases in Erie County are all younger people, with two being in their 30s and one being in their 20s, and we expect that all three will fully recover. But this goes back to what I've been saying for the last number of days, is that we believe our younger people are often been our super spreaders, people who have symptoms and are passing them on to others. I'm not saying that these people have spread it beyond themselves, but obviously younger people have been in contact with other younger people, and so we just want to make sure that everyone, no matter whether you're old or young, understands that we all need to do our part in terms of the social distancing and all of the other things that we have asked the community to do.
You said, County Executive, that you're still trying to figure out if this person traveled outside the county or how he or she might have contracted this?
Well, we know there was travel. We're just trying to get the details on how long ago that travel was, and was it to a hot spot, and those type of things. And we're not sure how extensive that travel was. So those are the kind of details that unfortunately I didn't have prior to this press conference, but that we expect over the course of the rest of today we will have a much clearer understanding of where they had been, and would this be a disease that they possibly, or most likely contracted, I should say, traveling, or whether we believe it may have potentially been community spread. So those are the things we're really trying to dive into right now to figure out.
Okay.
Erie Talk Radio, are you on with us today?
Hi, Kathy. It's Joel Natale. Just a quick question again to confirm that we do not know how the test was conducted, whether it was through the Allegheny or through a commercial lab or through the state health lab.
We do not know that, and I can try to get further clarification on that from my staff and get that out to all of the media outlets. And I will do that when this is over.
And just a quick follow-up on negatives, if you have a negative number for today.
In terms of how many negative cases in Erie
Correct.
County, I don't have that number with me right now. I do know in the state, and of course you probably see this on the state's website, 4,964, and again 480 positive, but I'm not sure what our negative number is today. Okay, I'd like to go back to Erie News Now if you have another question.
In relating to the governor closing the non-life-sustaining businesses and the waivers, we know that WabTech filed a waiver. Do you know anything about the status of that?
I do not, and I asked the governor's staff last night, and again, they didn't have an answer yet. I've actually talked with management at WABTEC just to discuss this in general. So I know everyone wants to do the right thing and do the thing that's going to help our community the best. So we're waiting to see. My understanding from the governor's office is they want to release all the waivers collectively. So they were, as I said, they were going through thousands of them as of last night, and we expect to hear that by later today. Erie Times News, did you have another question?
No, I'm fine. Thanks, County Executive.
Sure. How about Jet T?
Kathy,
okay.
Kathy, it's David Bruce. I'm also on the call with Ed.
Okay.
I do have a question. Kathy, can you talk a little bit about, we've been seeing nationally about how certain states, certain health systems are needing health supplies, and some of them are in short supply. Have you talked at all with the health systems here about whether they are in search of more supplies, or has that not been an issue here locally?
We have been in contact. My emergency management personnel are in daily contact, if not more often than that, with our local healthcare providers. The supplies are going to become an issue as this grows, we believe, and so I know many are looking to see where we can find more supplies, whether it's nationally or even internationally, and there's a number of companies and individuals and certainly government officials that are looking at how we can obtain the supplies that we need. But this is a problem across the nation, we know for sure, and it will be a problem here, although I think currently we are okay. Let's see, who else? Erie Talk News, or Erie Talk Radio, I'm sorry.
No, I think I'm good, thank you.
Anyone else have another question?
Yeah, hi, Samir with Jet TV. So are you able to release at this point where that person was in the county, or are we still not going into that?
I cannot release where these people live, and I guess I'll just give a scenario. Let's just say that this individual, let's just say they live in Harbor Creek, and they work in the city of Erie, and they grocery shop in Summit Township. Where they live may not matter anywhere near as much as where they might have worked or where they had a lot of daily activity. And when people ask me this question, I ask, how often do you interact with your neighbors right next door to you versus how often are you interacting with the people that you actually work with every single day? So the location of this person is not really the issue here. The issue is that each one of us needs to do our part to stay 6 feet apart from anyone we come in contact with, because we don't know who all is infected at this point. So we will not be revealing the municipality or certainly not the address of anyone that we know of is already a positive case. Any further?
Kathy, it's David Bruce. Yeah, it's David Bruce again. The Mercyhurst situation, have you heard anything from the university folks since their quarantine ended yesterday?
We have not heard anything. We put it in the hands of Mercyhurst after we sent them written notice that we wanted all of those students quarantined until yesterday, March 21st. Just assuming that those students have now departed. We had no contact with Mercyhurst saying that anyone had come forward with symptoms of COVID-19, and so we believe that that situation is basically closed. But I will actually have my staff follow up with Mercyhurst tomorrow just to kind of tie any loose ends up with that particular incident.
Would that be something you might have as early as tomorrow morning's press conference, or would that be later in the day?
I'll try to make sure that the staff circles back with Mercyhurst in the morning so that when I have my press conference tomorrow, I will have further detail on that for you.
Thank you. Thank you.
Mrs. Dahlkemper, this is Lisa Adams from Erie News Now. I know yesterday and today you've been encouraging people to not travel outside of Erie County, but a lot of people have family members coming into Erie County, maybe because of the situation that's going on. Is that something that you would discourage, especially if they're coming from other places across the country or even across the state where the problem is ballooning? And is that something that can be avoided if students are coming home from a college or grad school?
So Lisa, I think you bring up a great question. And I was thinking about this just this morning. Many of us have family members, particularly our children, who live in bigger cities. They may be coming home because school has ended there and they no longer have school to be at and a dorm to live in. They may be coming back because they simply want to get out of these hot spots. You know, New York City is a prime example of one of those hot spots, and I'm sure that there are many people who have children and loved ones who live in New York City. As they come back to our community, if they do, what I would recommend is that they self-quarantine. And I've heard of this happening, and I think that those who've taken that precaution, I want to thank them out there in our community. So those people who have come here from another city have self-quarantined themselves within the house. Now, when they self-quarantine, that means they should be in a separate room and actually using a separate bathroom. And so that is going to be difficult for some, depending on what kind of living situation you have. Certainly, I would not recommend that they come into a home if anyone is immunocompromised, has some underlying disease that could put them really at a very high risk. But I would recommend that anyone coming into our community from another community, particularly if it's a place where we know there's known cases of COVID-19, that they do the right thing and quarantine themselves until they know that they'll be symptom-free. And and that recommendation is 14 days. Which I know can be a long time, but again, we're trying to save lives. We're trying to stop the spread of this virus in Erie County, and that's why, for those of us in Erie County, I'm asking us to stay in Erie County and not travel outside, especially to these hot spots. And you can go on the CDC's website, and there's a great map there, and you can look across the nation. You can find out the cases county by county, state by state. Now, when you look around us, Chautauqua County, Warren County, Crawford County have not reported any cases. Again, we think that is probably just like Erie County was just a few days ago when we had no cases, but we felt it was just because of the testing and the inability for people to get tested. So we don't think those counties are probably free of the virus, but we think it's obviously probably a very small occurrence at this point. But we obviously don't want to spread anything we might have here to another county, and we don't want to bring more virus in. So the more we can just stay put, the better for all of us.
Hey, Kathy, Samir from Jet. So I guess talking about spreading, so I guess what is the likelihood that we could ultimately see like the Erie County borders shut down?
I don't think I can speak to that right now, Samir, but I think the scenarios are out there across this globe. And we just have to look to those areas across the globe that have had just huge incidents of this virus affecting people and actually killing people. So we are hopeful that we are really doing what we need to do in this community to stop this spread, and that we won't ever have to get to that extreme measure. But obviously, that is going to be a decision continually made on a day-to-day basis as we watch this disease progress. Every day for us has been different. Every day has brought us surprises and challenges that we have come forward and met, but we have never seen anything like this. And I think I've mentioned this before, but the staff in Erie County government, excellent staff, have been through a lot. They've been through natural disasters, they've been through 9/11, they've been through the Great Recession, and they have never seen anything like this. And as much as we try to prepare with tabletop exercises and all the other things that we do on a daily and monthly and yearly basis in county government to protect the citizens of this community, this is something that was really way beyond the scope, I think, that anyone ever imagined would hit us. And I think anyone out there who's watching this knows that's not only for Erie County, but that's for the entire nation and the globe. So we're doing our best to respond as will be, and we will make decisions as need be, again, to protect the lives of Erie County citizens the best that we know how and are able to. Is there any final question?
Kathy, it's Joel Natale again. We've been getting some reports here to the radio station about municipalities, small police departments in the county not being having access to hand sanitizer, to masks. What is Erie County Emergency Management doing? What kind of confidence for personal protective equipment are available for the little municipalities and first responders?
So we are doing our best to utilize the limited supply we have in the best way that we know how. I know one thing we're doing is we have masks at the hospitals, and when an ambulance comes into the hospital, they have masks on the first responders in the ambulance. We have a mask to exchange with them. So we have a supply there. They leave one and they get a brand new one. So we're trying to make sure that those people, those who are going to actually be bringing people into the hospitals, have what they need. Some of this is that each municipality is charged in their own emergency management. That's actually under state statute. Not to say that we don't want to help them, but we are hoping that they have been doing what they should be doing all along and have a small supply at least, or some supply of these life-saving and personal protection equipment entities. So what they call PPEs. So personal protection equipment. And those who don't, I know, are talking to my staff and emergency management. The unfortunate thing is we have a limited supply, and we have to make sure that the PPEs, as we call them, are in the hands of those who we know will need them most. So we're not able to get everyone PPEs if they aren't in a situation where we know that they're going to be at risk. So I guess you would say we can't do it prophylactically as well as maybe we would like to. Now, as again I said, I know that there's many people across this nation, and even in our own community, who are looking to try to increase our supplies here in this community. But this is a serious situation that our country is in, and is something, as we get out of this, obviously needs to be addressed by our federal and state and our local officials. Can I take any questions, or if no others? And well, thank you again for joining me today. Again, we will make this a daily briefing as long as need be. I again want to thank the people of Erie County who are continuing to assist all of us, those in public safety, public health, your acute care, healthcare workers, and really so many in this community who are working to protect you. We can't do it without your help. So thank you for continuing to do all the things that we've directed and asked you to do. And I will speak again with you tomorrow. Thank you.
And you've been watching a live update from the Erie County health and government leaders on the COVID-19 virus in Erie County. In case you just tuned in, here are some highlights of what was discussed. We heard from Erie County Executive Kathy Dahlkemper. She mentioned that Erie County does have our third case of COVID-19. That person is in their 20s, and that rises the statewide total of cases to about 480. Now, that person in Erie County, they're still gathering information on them because they just got the information last night. They're a resident of Erie. They don't know where exactly they were tested, but they're not in the hospital, and they are being quarantined at home. And also, Kathy Dahlkemper mentioned that the county is currently looking for more supplies. So as of this afternoon, here are some of the latest confirmed cases of coronavirus near us. Erie County, we're confirming the third case of COVID-19. No cases reported in Crawford or Warren counties, and there are no cases reported in Chautauqua County, New York, but there is one confirmed case in Ashtabula County, Ohio. And across PA, 480 positive cases of COVID-19. 2 of those people have died. Nearly 5,000 people have tested negative. And this weekend and until further notice, what should you do? Well, the best advice is stay calm, stay home, and wash your hands often, and practice social distancing of at least 6 feet. And we'll have the latest updates on COVID-19 anytime on YourErie.com, and a complete wrap-up of the latest developments tonight on Jet 24 Action News at 6. We now return to your regularly scheduled programming.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to YourErie.com. We now return you to your regularly scheduled programming.